How can leaders fully embrace their responsibility to nurture the well-being of those they serve? Our next guest, Dr. Kent Bradley, is addressing this challenge as CEO of BTN Advisors and author of Full Embrace. With a diverse background spanning military service, healthcare leadership, and board roles at multi-billion-dollar companies, Kent brings a unique perspective on activating change and unlocking human potential. Altogether, and drawing from his experiences as a retired Army colonel and former healthcare executive, Kent shares insights on leadership, well-being, and the future of healthcare delivery. Join us to explore how Kent's philosophy of leading with humanity, love, and responsibility is shaping a new paradigm for leadership in healthcare and beyond. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Dr. Bradley. A big welcome to our podcast, my friend.
Hi, Mike. Thanks for having me. It's great to be here.
Well, given your passion to activate change and challenge individuals and organizations to tap into their leadership potential, coupled with your incredible and inspiring professional journey, as well as the publication of your new book, I cannot wait for this conversation as we have much to discuss. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast. You will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Kent, it's almost time for our community to learn how you and the BTN Advisors team have become a full-service human potential service provider focused on the key elements of well-being, which include career, financial, social, physical, and community, as well as to discuss your new and inspiring book, Full Embrace. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Well, Mike, first, I just want to say thank you for this opportunity and congrats on this amazing platform and podcast that you're providing. I always go back to my mom. My mom had this advice to me when I was a young teenager. Don't be so heavenly minded that you're of no earthly good. And I would pass that advice on to others who want to reimagine healthcare. And what I mean by that is sometimes we can just see the problems and we think we know how to fix things. And it's easy to spot problems, especially in our healthcare system. It's much more difficult to understand why they came to be in the first place. There were well-intentioned people that created systems that are delivering a lot of good. And that advice of not being so heavenly minded also grounds us on the truth that it's going to take hard work. It's going to take a roll up your sleeves attitude and a much more reflective approach that allows us to then reimagine in a way that can actually deliver on an impact and a result that's going to advance health for all.
Kent, so timely and so needed, especially during this time of great upheaval, disruption, disintermediation, et cetera, especially brought on by COVID-19 and how everything in our lives, professionally, personally, or otherwise, was just completely upended. Kent, has this been one of those things that is so cliche, but I guess kind of true, now more true than ever, given where we currently are, and especially, and I know we're going to talk about it on the other side of the commercial break, that you have had some amazing leadership positions in healthcare and have been working with some of the leading organizations in our industry. But what you just shared, is that more timely and salient now versus kind of the before times, before COVID-19? And is there any other advice for our community that you have, given where we are currently and this massive upheaval and disintermediation that we're experiencing?
You brought up COVID-19, and I think that's a classic example of a forcing function. It's very difficult for us to change, especially when incentives and other things are not necessarily aligned for us to make the bold moves we may want to make. There's a lot of headwinds to that. But forcing functions like COVID-19, like financial disrupts, global crisis that is going on and conflict are all causing us to, and therefore forcing us to reimagine how things could be, should be, and hopefully will be. And so, yes, I think it's an important part of the whole situation we're in. Definitely allows us the opportunity now to make perhaps bolder steps than we'd be willing to take in the past.
Well, we're going to discuss some of those bold steps that you have been delivering time and time again in our industry. I've been waiting for quite some time to have this conversation, as you are somebody that I have admired along my entire journey in healthcare and innovation. We're going to discuss your journey, what has led up to BTN Advisors, the new book that I know many of our listeners are going to be thrilled to be able to grab a copy of. We're going to unpack all of that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you, who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Dr. Kent Bradley, CEO of BTN Advisors. Kent, thank you again for being with us and spending time with our community, an amazing community that has rallied around this podcast now for almost 5 years. We're getting close to that 300th episode. Maybe, just maybe, you might pull the lucky 300th card. I'm letting our current guests know that, hey, at some point, it's coming soon. But it's because of leaders like you and the community rallied around this podcast that we are where we are today, about 5 years in and 300 episodes strong. So let's get after it, Kent. You have had a storied career. You have been pivotal to a lot of us here within the healthcare innovation ecosystem, not just where I first met you in Denver, Colorado, as we were building this ecosystem a mile high, but across the nation. You have been pivotal to so many of us, Kent, and you've had, again, a storied career along the way. We'll talk about that, which led you to today in being the CEO and launching BTN Advisors. And of course, got to discuss the book, Full Embrace. I know this has been a huge passion project of yours and something that I know many are going to find value of. And of course, we got to discuss too, a little bit of that crystal ball. What are you seeing, Kent? You've been in the big boardrooms. You've been in the C-suite of some of the largest organizations in our country. What are you seeing on the horizon? Again, going back to the front end of this episode, during this great time of upheaval, disintermediation, disruption, what are you seeing from the pilot seat? And then, of course, we'll kind of wind things down and ask how our community can be helping you. But first, Kent, let's rewind that clock a bit, my friend. How did this all come to be, from Safeway Health to being a board member at Common Spirit to causing trouble with disruptors and tech innovators like myself? How the heck did all this come to focus in the first place?
Yeah, that's a good question. Sometimes I reflect and wonder about that as well. It has to start with a mindset and people, a mindset that is always open, where you could provide a service and meet a need, just with that heart of trying to do good and make an impact. And the people that come into your life that give you opportunity, and sometimes opportunities you never thought were even possible. So I've been blessed to have people in my life and a mindset that has been open. And I mean, when you really think about it, it started for me in high school, being raised in a single family and having a high school coach that loved on me and showed me that I had immense potential and believed in me. And then transport that through the leadership experience that is gained through an institution like West Point that helps you understand service before self, that you are living a life that is bigger than yourself and that is team focused. And then translating those lessons learned into medicine and then the healthcare journey I've had, both in the military while serving, wearing our nation's uniform, to then serving in other capacities through Safeway as a big opportunity, through Martin Blank Associates as a consultant, I think it's been one thing after another where I've been really fortunate to have people an opportunity.
And some of those stops along the way, again, some of those household names for us in healthcare, Safeway Health, being a board member at Common Spirit. What were those experiences like? And specifically for today, what did you see in those seats of leadership that can be applied to today for our audience that is experiencing, again, this great time of disruption and upheaval? Many of us have come in and said, we're going to change healthcare, especially those tech innovators and disruptors. And it is incredibly hard to do, Kent. And as you mentioned earlier, sometimes a lot of the systems and processes that are in place that make this big machine that is this multi-trillion-dollar industry, those were well-intentioned at times. But again, if you look back at those leadership positions that you held and apply it to today, what are some key points of advice that you have, especially for our entrepreneurs and innovators that are working to bring new and exciting and novel technologies, ideas, and disruption to our industry?
Wow. I can dig a little deep on this, and I'm going to try to thread a couple of things together for your listeners, and hopefully it will make sense. I think from the perspective of my time at Safeway, a big push, and this set the stage, it was 2011. We didn't have the maturity of the technologies today, but I had the opportunity to talk with telehealth providers that were just getting started, with 23andMe and other startups that were there, Omada Health, then they were just beginning. And the real focus was around consumerism in healthcare. There was the consumer-directed health plan. The high-deductible health plan was just getting launched. The amendment healthcare reform, the Safeway amendment to the healthcare reform. And what I saw at that point in time was that there was early interest, but maybe not the adoption and the robust ability to deliver on the promise of a consumer-like experience in healthcare. I mentioned earlier forcing function. The forcing functions were not there for the actual adoption of telehealth. The openness of the public to the quantified self was just beginning. Wired magazine at that same period of time, 2011, 12, had published this, quantified self construct. So there was interest, but yet there wasn't the adoption that we are seeing today. But I do think consumerism and the real call there isn't necessarily consumerism, but it's the reframing of healthcare to the reality that the experience of healthcare was woefully inadequate. And we needed to improve upon the aspects of the delivery of care to make it as good as all the other experiences in a person's life that they're now receiving. And a lot of that could be done through technology. And that was the technology that was being delivered at that time and invested in wasn't on the electronic medical record, which at the early beginnings was like a ransom note. I mean, the note that you would get out of it looked like something that was cut and pasted, and it was horrible. And it was all for coding, and it really wasn't around the physician. But that was where technology was focused on. It really wasn't focused on a consumer experience. And so that created opportunities, right? A lot of early entrants into the space to improve upon. And then I kind of had the opportunity, as you mentioned, sit on the board of Dignity Health and US HealthWorks, and then that got bought by Concentra. And I began to see the boards beginning to recognize this importance of technology. In fact, Dignity Health stood up a technology committee, which I was eventually blessed to be the chair of. And there was this recognition of that. And then fast forward to the last few years, I've been very fortunate to enter a completely different industry. And that happens to be in the direct to consumer space and the gig economy through independent entrepreneurs through Herbalife. And so Herbalife really has a delivery of nutrition through coaches and individuals that are very independent and entrepreneurs in and of themselves. So what I saw from that period of time was the power of being closer to what the market actually needs. And that's been a revelation for me around the growth of the gig economy. So in the first half of 2010 through 2015, 16, it was about consumers. And then now 2016 on, it's been around the disbursement of change agents, who are more closely connected to consumers and developing a value proposition to them in the gig economy. And then technology, again, being the connector of the two and creating it so that certain needs are met, both from the provider of the service as well as the consumer. And throughout the whole process, the transparency in the feedback loop of the service being delivered, immediately getting a response, knowing that I'm a 4 or 5 star. These are lessons learned in healthcare. The health systems need to understand that that's what we expect, that level of transparency, that feedback loop, and that opportunity for more independent gig interim providers of service is, I think, something else that is, even post-COVID, more and more people are seeking greater autonomy on the place of work and how they choose to work.
Well, yeah, we're absolutely, also, Kent, to that point, we're seeing a lot of significant growth in this kind of direct primary care models as well, right? Which we can kind of parlay into those frameworks and those rubrics of this notion of gig economy or independent work. I saw an article a couple of years ago, I think it was in the Wall Street Journal, about the rise of the me-EO, right? This notion of self being my own business, right? So I think you're spot on, and we're going to continue to see those trend lines in health and care. The notion of this old edifice that has been healthcare, a lot of, let's just call it what it is, a lot of these younger generations of consumers, they don't look at themselves as a patient, they look at themselves as the consumer. And so we're seeing those types of things changing the way we look at how care is delivered and then through what mechanism. So thank you for sharing that, Kent. Of course, that then led you to today and launching your company, BTN Advisors. Maybe share a bit with our community. Who is BTN Advisors? What are you guys working on? And then, of course, we're going to have to discuss the new book, Full Embrace, as well, because I know how passionate and excited you are about that body of work. But let's first go there. Who is BTN Advisors, Kent?
So BTN Advisors, I'll give you a little backstory of BTN. It was started originally right after I left Safeway. First off, I have nothing but positive things about my experience at Safeway and being the opportunity to run a separate company called Safeway Health. But when I left for one very specific reason, and that was to take care of my mom. My mom was diagnosed with lung cancer and chose not any medical treatment, and instead understood the risks and was a truly informed consumer. And I decided to move in and spend more quality time with her. It was something that I think very few people are given the opportunity to be able to do, and I took that opportunity. At the same time, I wanted to still be somewhat engaged, and in the health and health tech field, started a company called BTN Advisors. And BTN simply comes from a quote from Mozart, who said it's music is played not just in the notes, but the space in between. And what I recognized is that a lot of healthcare, a lot of what we do in general, has to do with the things that are in between, the space in between. And to put it more frankly, we take this misunderstood notion of hard and soft skills as well, and we think the space in between is the soft stuff, if you will. And I've come to realize that that's such a critical part, realizing how we interact with one another, how we build teams, how we think, how we create systems, how do we think about strategy, are all things that are not necessarily things that just come straight from a book, but come from a lot of experience and nuance and really deciphering the space between. So the company was formed to basically be an advisory company, and I was fortunate to advise some early health tech companies while I was taking care of my mom. I then was able to support the University of Denver, and I was the Daniels Fellow for Leadership and Well-Being, and that's where we had an opportunity to meet. And I saw your disruption, your passion for starting something that was truly a wonderful opportunity for the entire, not just for Colorado and Denver, but really an example for a space also being an innovative place. So I then moved on to Herbalife, and I sunsetted the company. And my wife and I decided to move this back up. She does a lot of financial well-being support through payroll, benefits, advice, and human resource support. And with my passion around strategy and supporting individuals, especially understand how to build high-performing teams and how to navigate ideas so that they are more than just an idea, but have legs to potentially have an impact. That's where I've now been focusing my efforts. You mentioned the book, and I'll share a little bit about part of it, and that is one of the wonderful traditions of Dignity Health. Before a board meeting or any meeting, a committee meeting, a board member is asked to share a reflection. And it sets the stage for us to kind of take a few moments and pause and then go into the meeting. And I love that tradition. And whenever I was asked, I would share one of my reflections. I called them my musings because it was my opportunity to talk about something that I had been pondering about for a very long time. And therefore, I had created a collection of some of these musings, and people began to ask me, hey, you know, we'd love to be able to see what you read those again, or is there some way we can get access to them? And so the book really came from some admonition of some friends saying, you know how you used to do these musings? Maybe you could put a collection of those. So I took 15 of them. They all start with a poem that I wrote. Believe it or not, I write a little bit of poetry. It's really just writing in a different format. But I think in prose, more than maybe it helps me be a little bit more succinct. And that's how the book was formed, just my thoughts through those reflections and some poetry that kind of comes together into what I hope helps people fully embrace the reality that as a leader, they have responsibility for not just influence, but the well-being of other human beings. And I recognized that the first time when I realized I was a dad, and I realized that when I was given a team and we were going into combat, and I realized that today in every interaction I have with individuals that are trying to make a difference in this world.
So to follow up on that, because you segued perfectly into the discussion of Full Embrace. Kent, I know it's a new publication. Where can folks find it? Is there a place that we should drive our listeners to? And of course, whatever you do share, we'll also include in our episode notes as well.
Oh, thanks. Yeah, it's on Amazon. It's in hard copy. It is also in paperback, and you can read it for free under Kindle Unlimited. So just go to Amazon. If you look up Full Embrace and add my name, you'll be directed to the book.
Easy enough. And for our listening community, of course, head into the episode notes. We'll link over to the Amazon store for Kent's book, Full Embrace, over there as well. Kent, of course, it's very important. Let's dive into just maybe one or 2 points out of the book. We don't want to tease the entire book on the episode, but heading into this, as we were getting prepared for the conversation, I mentioned to you, we have some of our nation's finest leaders in healthcare at some of the biggest organizations and some of the smallest startups that are rallied around this podcast to learn from leaders like you. If you had 1 or 2 key pieces of advice from the book that, of course, we could dive more into once we do get a copy in our hands, what would you share with the leaders rallied around this podcast? And I think one thing to focus on, as you mentioned it, there's great responsibility when you do become a leader in whatever capacity that is, especially when you're leading other human beings. What maybe is a 1 or 2 quick hits of advice that you would give our community who are in those leadership positions?
Yeah, I think it starts with caring. You really have to care about the unbelievable opportunity and privilege it is to be a leader where others look to you to support their well-being. And that's true in the professional space because, there's jobs tied to that and their careers. And it's one thing to be an individual contributor and provide particular expertise. It's another thing to recognize that what you do is also nurturing the well-being of other people in their professional career, and therefore it spills over to the personal. So you should care about that. It's meaningful. The other thing is I talk about it. The book's broken down into really 3 segments. One is humanity, that you lead with humanity, that we're all equals. We're all, at the end of the day, we're all just humans trying to make it through life and do it in a way that supports our families and creates an impact. So recognizing our shared humanity, recognizing that something that we all need, and we don't necessarily put it in the professional sense in this way, but we all need to do it with love, with the same kind of depth of caring. And the third is that there's a responsibility that comes with leadership around. It's not just what we do, but there's a responsibility that we are leading people towards something that is actually of value, that is actually going to be to their benefit and to the benefit of others. And so humanity, love, and responsibility, I think, will be three key takeaways as it's framed out in the book.
Well, let's take those three pillars that you just mentioned about the book and let's apply it to taking the proverbial crystal ball off the shelf, Kent, and talk a little future state, right? As we mentioned, even at the front end of the podcast, going through great upheaval, going through great disintermediation, massive change in healthcare right now, some for the better, some for not. There are going to be winners, there are going to be losers. But again, there are a lot of folks that are in leadership positions tuning in. What are you seeing on the horizon? Because I know you get to still work alongside and help lead some of our finest leaders in our industry. What are you seeing on the horizon, Kent, in regards to where our industry is heading? And what are the things that we should be mindful of? Call it even over just the next 2 to 3 or 3 to 5 years. What's top of mind for you? What are you seeing that we need to be mindful of moving forward?
I think that there's several things that are happening. I'll take the most obvious first and then go to the more perhaps less obvious. The most obvious is the opportunity with generative artificial intelligence to think about creating an actual better experience in support of very specific use cases. And just like we've been accustomed to the hybrid model of working today, where people work remote and work at home, I think we're going to become comfortable with the hybrid model of service being delivered by a human and by artificial intelligence. So I believe that that's something that's coming. It's coming very quickly. And the forcing function of COVID got us very comfortable that very few companies today, other than maybe healthcare or certain aspects where you physically have to be there every single day, many industries have become very comfortable very quickly with a hybrid environment in the workplace. And the forcing function of how quickly generative AI has hit the scene and the openness of that architecture is going to make it so that we have to be comfortable with the hybrid approach to the delivery of services. I don't just say care, because it's more than just the delivery of, like you said, there's health and then there's care, and the consumer is going to choose options that will promote their health. And when they need it, they're going to choose options to support the care they need. And in both cases, a hybrid approach is coming, if it isn't already existing in many respects. 2, I think that we're going to find that we are going to consolidate only to fragment. What I mean by that is that I think there's a consolidation that's naturally occurring for survival of the existing way in which healthcare has been thought of, in the way in which care has been provided. But if we are thinking about health, health is not a centralized from up high delivered. It's delivered by hundreds of thousands of change agents called coaches and community activators and caregivers and trainers. I mean, it's in many, many ways. So technology can have an enablement, and how does companies and organizations think about the dispersion that is needed to reach so many people in the health space in particular. So I do think that there's an interesting corollary to the central monopoly of perhaps the taxi business to the Uber business. We're going to see that in healthcare, or the industry, if you will. Those are 2 that I can think of right off the bat. And then there's going to be, of course, winners and losers in that space. I think a third area is this continued wrestling around the security needs and the privacy needs through all of this. And so how we think about the delivery. Right now, the healthcare system is very hesitant to incorporate health-related biometrics, the fitness devices. All that is still stonewalled outside of the healthcare system because of the security and privacy or the architecture, a lot of other things. I think we've got to get past all that, and we have to realize that people are not want to be treated as a patient as you began with. They're a human being, and all these data points are an important part of their journey. And so the privacy security concerns have to be figured out in a way that allow for a complete view to occur in the health industry of the future.
All very salient points. And like you said, Kent, a lot of those big areas that you just focused on what you're seeing on the horizon, they're coming at us fast. They're coming at us in real time. And these things are unfolding right in front of our eyes right now. So very, very important things to be mindful of. Thank you for sharing a little bit of that perspective. We'll throw the crystal ball back on the shelf for now. Kent, we'll bring it back to current state. Of course, always love to get our community involved with our guests. What's one problem, need, or question that you and your team have that we can be helping you with?
I'm going to go up pretty high level now. It's just kind of a world peace level statement. But, as I see a lot of our technology focus and a lot of the early stage companies, some of which have grown pretty quickly, I think we need more help with addressing the need for the most vulnerable in our society. A lot of our programs that I see are these apps and digital health solutions are really focused towards, in reality, a very slim demographic that can pay for the services being rendered. I mean, I won't call out any one particular, but if we were to look in the spectrum of mental health as an example, the services being delivered are not necessarily the services that are able to reach the indigent population and the underserved. So I think we really need help in helping the vast majority of the people who are struggling simply to make ends meet. And globally, now having been to over 40 countries personally and seen many, many different communities, globally, there's a need to address solutions that can reach people that are less like the executives that might be listening to the podcast and more like individuals like you and I were and continue to be working in various communities. So I think that's going to be an important ask to think about.
Well, to have these conversations and to continue this collaborative dialogue, Ken, because it is an important one. We need to be thinking through that. And I know you do a wonderful job in working with quite a few innovators across the industry, some that I know personally that I know you're working with. Ken, how do folks get a hold of you to have these kind of conversations, to bring new ideas to life? How do they get a hold of you? Social media handles, websites, or otherwise? How do they track you down?
Well, I'm an open book. Email-wise, just kent@btnadvisors.com. Of course, you can go visit our website, btnadvisors.com. I just started a new Instagram. I shut down my personal one, and I just start one called Dr. Kent Musings. But those are probably the sites. And of course, LinkedIn. You can always reach me on LinkedIn.
Oh, yes, you can. I know you're very active on there for sure. But for our community tuning in, simply scroll on down to your favorite podcast player to find all those contact points for Kent and the BTN Advisors team. Or you could head over to our free global online community at passionatepioneers.com. There will be a post for Kent's episode where you can also leave comments, feedback, or otherwise. And of course, to get those contact points online, again, over at passionatepioneers.com. Kent, I could be here for hours on end talking to you. I'd never, ever have a boring moment spending time with you, my friend. We're going to start winding it down so you can get back to the good trouble in getting the word out about the new book and continuing all the great things over at BTN Advisors. But before we let you go, I have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
in order to cross into a foreign land and do something that's bigger than yourself, you have to be open to being able to be a true pioneer. And I'm passionate. I'm a passionate pioneer because that's what it's going to take to create the breakthroughs we need in our society today.
Well, my friend, I have known you for many years, and you do exactly that time and time and time again. So thank you for taking time to be with our community and sharing all the wonderful things in your camp, Kent. I'm honored and very fortunate to be able to also call you a friend. But for now, again, thank you so much for being with us today.
Thank you, my friend, as well, Mike. And congrats to you. What a wonderful platform that you've created. And I just heartfelt thanks.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.